So we are here today to talk a little bit about your brain. So, apologies again. So, in case um, you didn't know, April is Stroke Awareness Month. We're a little bit late in the month to start this, but we are starting a series on information you might need to know about stroke. Whether it's right today, we're going to be talking about basic anatomy of the brain and what causes different deficits, and we're going to be doing a couple of other presentations on different things about stroke. So keep an eye out for that going forward. All right. So today I'm doing the presentation of Know Your Brain. So it's basically basic brain anatomy and common findings for strokes. There are various kinds of strokes here that you can see it on the page. So the two most common are ischemic strokes and hemorrhagic strokes. Ischemic strokes, as you can see in the picture right here, is when blood flow is blocked to a certain portion of the brain, which causes damage in those areas. So here you can have different kinds of reasons that a blockage occurs, whether it be a blood clot from somewhere else in the body or narrowing of vessels in your brain. Or you can have a hemorrhagic stroke, which is where here you can see different areas where weakened walls of your blood cells in your brain cause bleeding into the brain, which then the pressure of the blood causes damage to the brain, and there's a stroke. There are things called cryptogenic strokes, which have an unknown cause or reason for deficits. Those are a little bit of a mystery. And then there are also things called TIAs, or transient ischemic attacks. So that's when your brain is deprived of oxygen for short periods of time that does not cause lasting deficits. So you could have deficits and then they can go away. I'm going to try to get rid of this little pop-up we got going on. There you go. All right. So here is typically when if you had a stroke and you go into the hospital, they take images of your brain to confirm what's going on. These look a little bit different on images. This would be a CT scan. So right here you have the ischemic area that is a little bit darker, whereas a hemorrhagic area tends to be this lighter, brighter color and intensity. All right. Something that I want to make known before we continue on with this presentation is that every stroke is different. I am going to go over the basics, the very kind of most common presentations, but every stroke is different. Everyone's recovery is different. So keep that in mind. And just because I say one thing doesn't mean that necessarily is you or would be how you presented with your stroke. I also want to highlight there is no time limit to recovery. Whether you had your stroke a week ago or years ago, there is always room to continue to pursue your goals, whether it be recovery of movement or recovery of a functional skill in an adaptive way. Always keep going on your journey. Life is therapy. Going about life is the best way to get back to where you might have been previously. So we're going to, all right, we're going to keep on going. So basically we're going to run through the different lobes of the brain. I'm kind of a nerd, so if I talk a little bit over your head, I apologize. I'm doing my best. I want to highlight when we see this picture of the brain, this is a system that all works together. So when one portion of your brain is damaged, it can lead to deficits in different things in different parts of your brain because it is a system that all works together. So the first lobe we're going to start out with is the frontal lobe. It deals with those higher level skills of your brain, the higher level things. And so when you have had an assault to this part of your brain, you may have difficulty with with certain things. One of the big ones that we see a lot is planning out your day, trying to figure out how much time it's going to take to get dressed, or when you're supposed to get dressed, or how you're supposed to get dressed. That's a big challenge. Time management is also a big thing. And also there can be an impact on impulse control and knowing when you can and cannot do something, as well as emotions. You can either be more emotional than you're used to, or less emotional than you're used to, or overall less aware of other people's emotions. So all things to think about when it's the frontal lobe involved. There is a portion of the frontal lobe, it's the motor cortex. This is the easiest one to understand, in my opinion. This is where the movements of your body are controlled. I want to highlight that your brain works in a opposite manner. So the left side of your brain controls the right side of your body, and the right side of your brain controls the left side of your body. So that's something to think about when you think about the motor cortex, that it controls your movement, but the motor cortex on the left side controls the right side of your body. I have over here that it can also be involved with spasticity. So when there's a disruption to that part of the brain, it can cause difficulties with movement, weakness, but it can also cause what we call spasticity. And we'll be covering that a little bit more in another section of this lecture series. So why certain parts of the body are affected more than others with strokes is this funny thing. It's called the homunculus. It was one of my favorite things learning about when I learned about the motor cortex. This is the homunculus here. It just shows the distribution of what controls what part of the body, what part of the brain. So if you had damage in this upper portion of the brain, you're more likely to have difficulty with movements of your legs, whereas the further down you go, the more difficulty you might have with your hand or your arm. But it is possible to have all of these areas affected as well. But that could be an indicator of why one part of your body is a little bit more affected than the other. All right, so now we move on to the parietal lobe. This is where a lot of insight and awareness is located. So when you have damage to the parietal lobe, you might have difficulty seeing the deficits that you might have. It's also more difficult to pay attention to things, whether it be your spouse or the task that you're trying to accomplish. It also affects your awareness of your body. It might be hard for you to recognize where your hand or your leg is in space. So that's the parietal lobe. Part of the parietal lobe is your sensory cortex. So this is your touch and your senses. You might have difficulty feeling things, whether it be the heat in your shower, whether it's hot or cold, or the heat of the stove, or if you can't feel something brushing up against one side of your body. We're moving on back here to the occipital lobe. This is the lobe that lets you see. That's the main purpose of that. There are some things that are tied to memory within the occipital lobe as well, like visual association and things like that. And now we're moving on to the temporal lobe. The main functions and things that you might have difficulty with if you had damage in the temporal lobe would be with your language or with your memory. Both language and memory, I want to note, are very complex systems along with everything else in your brain, but they are located in many parts of your brain. So just because you didn't have an assault to that part of your brain, you may have difficulty with language or with memory. And within this series as well, Lorraine is going to be doing a little lecture on the anatomy associated with language and with cognition. All right, moving on to the cerebellum. This is your balance center. It's the little guy that lives at the bottom of your brain. It's not considered one of the main parts of the brain. It's kind of a more primitive brain, so it's not a lobe, it's a thing in itself. And this tends to be associated with balance. There's another note that if you have an assault to your cerebellum, you can also have some slurred speech. The most basic portion of our brain is the brainstem. This is like the fundamental life giver of our brain. So if you did have a stroke in this area, it controls a lot of important things. You may have difficulty with chewing and swallowing. You may have difficulty with breathing. Balance is also a biggie here. It might be really difficult for you to coordinate movements or have balance. There is this thing that I want to discuss. It's called Wallenberg syndrome. It was just a interesting thing to learn about. It happens sometimes with a stroke in the brainstem that you can have weakness on one side of your body, and then you can have disruption of heat, temperature, and pain on the opposite side of the body. So actually both sides are affected in certain ways. So this was kind of like an overview. I know it went pretty quick, but there are a lot of really good references on what those different parts of the brain are. So now we're going to discuss a little bit about your left brain and your right brain. So as you can see in this picture, your left brain and your right brain are very different. As I said, the left brain controls the right side of the body and the right brain controls the left side of the body, but there are differences there as well. As you can see in this picture, it's more black and white. It's more, left brain is more black and white, more logical, and you can see the different parts of things, whereas the right brain has more artistic thought, more abstract thought, and you can see big picture a little bit better. Lots of different interesting things about right brains and left brains. All right, we're going again. Oh no, what's happening? Here we go. All right, so when we're looking here, I'm just going to go over kind of basic things that tend to be characteristic of a left brain and a right brain stroke. So with a left brain stroke, you see here, so if your left brain was affected, that means that the right side of your body was affected. These folks tend to are a little bit more cautious with their movements because they have difficulty understanding the parts that need to be in the movements to do things. It's also they're logical, and they know that they have some things that make it challenging. You can also have what we call apraxia, and we will continue to that'll be again in another segment, but I'll go over it briefly. It's difficulty with planning, with motor planning. So you may know how to do something, but it isn't connecting between your brain and your body, or you might be able to verbalize how to do something, but you don't even know, your body doesn't know where to start to be able to do something. So whether it's getting up out of a chair or just moving your leg, it's difficult to get that plan out to be able to do it. Also, the left brain is where you may have difficulties with language as well. This is what we would call aphasia. And Lorraine will be going more into that because there is an entire world of aphasia that I definitely could not do justice to. So we're going to be covering that in another education session. So then we move on to the right side of the brain, a right brain stroke. This would affect the left side of your body. People who have right brain strokes do tend to be a little bit more impulsive and have difficulty with judgment on being able to do certain things or other things in their life. It also can be difficult for these folks to be spatially aware or pay attention to the left side of their body. Left side of their body, things on their left side, people on their left side. There are certain cases that sometimes people completely neglect the left side as if it wasn't there. All very different presentations in that realm. So we went over a lot of things today. What I wanted this to be mostly about is understanding the different parts of the brain and why certain things might be difficult for you or why certain things might be affected with you. We want to empower you to try to make sense of it all. A couple simple things to do. They're a little bit not the most simple. But is to know your diagnosis. Don't be afraid to ask where your stroke was. Knowledge is power. Like it's saying right here, being more aware of what's hard for you can set you up really well to continue on in your rehab journey. It's also really important to take notice of things that you feel are difficult to you, as well as what other people say is difficult for you. Sometimes it's hard for anybody to see their own deficits or their own challenges. So it's important to take into mind those things that the people that care about you, your family, your caregivers, your therapists, your doctors, say to you. I wouldn't take it too to heart, but take it as an objective. Okay, you say this is difficult for me. I'm going to take that knowledge and I'm going to work on it. So Lorraine is going to be going through an excellent way of kind of organizing all of these things in a handout when she discusses aphasia in her presentation. But these are just 3 things that you can do to empower yourself and know a little bit more about your brain and about your stroke and what happened. So to end off our presentation, I want to go a little bit into stroke risk factors. So there are factors that show an increased likelihood of having a stroke. There are these ones that are on the screen right here that are non-modifiable, and I won't read through all of them, but I do want to make notice here of a prior stroke. So once you've had a stroke or a TIA, a transient ischemic attack, you are more likely to have either a full-on stroke or another stroke. So it's important to realize that once this has happened, that you keep that in mind. Unfortunately, these are the non-modifiable risk factors, the ones that you can't really help. But on the bright side, there are all of these other ones that are modifiable. So you have all of these things, including managing your blood pressure, smoking. If you smoke, it's a good thing to try to stop that. Physical inactivity is a risk factor, high cholesterol, all things that are able to be modified or able to be controlled with medication, lifestyle changes, and medical management. So I want to empower everybody that these modifiable risk factors are things to be aware of in this is your recovery, and it's important to become an active participant in lowering your risk for further assault to your brain and further health problems. All of these risk factors came from stroke.org, which is the Stroke Association. They have lots of very great resources. So the last thing that we're going to talk about here, and this is a handout from the American Stroke Association, is knowing what to do if things change with your neurologic status. Like I said, having a stroke is an indicator for it increases your risk for another one. So it's always really important to make sure that you are aware of all of your health conditions and are consulting with your primary care doctor and making sure that all of these things are managed. So over here, it has like a prevention checklist, including managing high blood pressure or cholesterol, improving activity, eating better, discussing certain things with your doctor of preventative measures. Another thing here is FAST. We'll go over this a little bit quickly, but you may have heard about it before. It is the quick rule of thumb and for recognizing the signs of a stroke. So the F is a facial droop. A is arm weakness, and I'm going to add on that of weakness of any kind. S is speech difficulty, and T is time to call 911. If anything changes with your neurologic status, whether it be speech, weakness, a change in balance, anything like that, it is not something to take lightly, and it's something to make sure you're on top of right away, because when it comes to stroke, time is brain. We want to make sure that you get the care that you need as soon as possible. So making sure that you and your support system, your caregivers, your family know these things and what to do in case of a change. It's always good, like I said, knowledge is power, making sure that you're prepared for anything that might happen. And the stroke.org really does have a lot of great information and references for changing your risk factors, awareness of of stroke and recognizing stroke in ways for lifestyle modification and just education about your brain and your stroke. So these are references. I have a lot of references on there about the pictures that I found because pictures are fun. But I do have stroke.org on here. And there are certain references about blood supply to your brain and things like that. I'm going to click back over here to Facebook. It looks like we don't, so that's fine. So I want to thank you guys for joining me. I know this was like going back to school, but we really feel like knowing your brain and knowing your diagnosis is very important, and we want to encourage you to know as much about what's going on with you as possible to empower you during your recovery.